Okay, a couple more features. The anterior interventricular sulcus, so the little sulcus between the two ventricles. The posterior interventricular sulcus is on the posterior side, and feel free to flip it right there. Okay, some of the coronary arteries and veins. There's the left coronary artery. So it kind of, what is it, like number, yeah, perfect, right where, so that's the left coronary artery. There are two parts of it, there are two branches. It breaks into the circumflex branch, and then it also breaks into the anterior interventricular branch. Anterior interventricular branch that goes through the interventricular sulcus. And then there's the right coronary artery, right there, that comes off the aorta as well. It splits off into the posterior interventricular branch. So into the posterior interventricular branch in the posterior interventricular sulcus. Keep it turned over because we're going to do some of the veins of the cardiac. There's the great cardiac vein. There's the middle cardiac vein. No, this is the middle right here. And then the small cardiac vein right there. They all drain into the coronary sinus right there, which drains into the right atrium. Another feature is the ligamentum arteriosum. It's a feature from when you're a baby, and it shunts off the blood. So the ligamentum arteriosum. There's the intra-arterial septum. So in between the two atria, a little hard to see, but it's going to be inside, in between the two atriums. As well, there's the intraventricular septum, so that's in between the two ventricles. There's a septum connecting those. Some of the valves. The first one that starts off is the pulmonary or tricuspid valve. So that's right. Tricuspid valve. And then the blood moves through the pulmonary or semilunar valve to the pulmonary trunk. The next valve is the bicuspid valve. The bicuspid valve. And then the next one is the aortic or semilunar valve. So you gotta look. I might get a good shot. Did you get it? Yeah. That's the aortic semilunar valve. Within the ventricles, there are the papillary muscles that connect the chordae tendineae of the valves. So the chordae tendineae are the little tendons that come off the valves and connect to the little papillary muscles down there. The trabeculae carinae are features of the ventricles. They're kind of like these little ridges that are muscular and allow more blood flow through, but allow it still to be muscular. Then we have the myocardium. Is that middle layer of the cardia, and then the endocardium, which is the thin serous membrane inside of the heart. It's going to be inside. And then the last feature is the fova ovalis. This is another fetal feature. It's a little that's a little hole that used to be there.